At Kaiser Permanente, active design is defined as those design elements that cause the building users, building visitors to have an active lifestyle. It could be something as simple as having a main stair that's immediately visible and accessible to the lobby that takes you up to the second floor or the third floor. It could also be something as simple as having walking paths around the facility, places where people can gather, where there can be award ceremonies or staff recognition or patient gatherings. Design excellence at Kaiser Permanente is establishing a baseline of what we think are the minimum requirements for the design of our facilities, whether they be inpatient or outpatient. What we decided to do was really look at something that was an aspirational guide that would say to the architects or to the engineers that were designing our facilities, what's the minimum amount of quality, what's the minimum amount of design excellence that we want built into our facilities, and how would we as the owner define that? When we talk about design excellence, there are a couple of great examples that have just recently opened at Kaiser Permanente that I think exemplify the idea. The first project I'd like to introduce you to is the Anaheim Radiation Oncology Clinic that was just completed this year. It's a beautiful gem of a building. It's one story. The exterior of the building is all glazed, but the glass is not clear glass. It has etched images of birch trees. It's a phenomenal view of living in a forest or being in a quiet wood, and it's intended to give that feeling of calmness, restful, peaceful atmosphere to the member or to the people that work in the building. Another great example of design excellence is our new facility at Antelope Valley. This is a facility that's in a fairly hostile environment. It's the high desert. Temperatures can be quite high at almost all times of the year, and there are relentless winds that whip around the facility. We wanted to make sure that we could make it possible for the member, their families, to be able to go outside and enjoy the outside environment at times of the year when the temperatures are low enough. Design excellence also means bringing the unexpected. Now, the unexpected in the case of the Antelope Valley Medical Office Building is a living green wall. As you approach the main entrance, you see an entire wall of succulents. It's an unexpected and refreshing idea that makes people smile as they go in the building. Another good example of design excellence is exhibited in our Westside Medical Center. The medical center is on a fairly small campus and has to accommodate a number of buildings. And yet the architect has done a great job in creating the illusion of great open spaces, different environments for people to enjoy, and a variety of places to walk and to sit. Design excellence can take many shapes and forms. At our Lonetree Medical Office Building, we have a fairly large building, but the architect has been very careful in creating small-scale, comfortable environments for the member or for their families, or even for the people who work in the building to use at any time during the day. Another element that's a hallmark for that building is their beautiful and extensive public art program. Some of the artwork is just there to be looked at, but other artwork pieces are there to be engaged with, to be touched, to be moved. In addition to excellent clinical care, we want our members, our patients, their families, their friends, to have an excellent overall experience when they visit our facilities.